my name is Maria Uribe. I have my school scrubs on and I have my student ID. We're going to be doing the IV insertion and removal skill today. Can I have your full name and date of birth? Thank you. I'm going to apply some alcohol and perform hand hygiene. I'm going to put on my gloves and gather my supplies, which I have here. I have my IV starter kit and my IV extension set. I'm going to be using a 20 gauge IV catheter because my patient's 40 years old, post-op, and going to be receiving fluids from the IV catheter. First thing I'm going to do is prime the tubing with some normal saline. Just make sure that there's no air in it for when I use it later. I'm going to prime it, make sure there's no air. I'm going to apply the tourniquet 4 to 6 inches above the insertion site. Making sure it's tight but not too tight. I'm going to check for a distal pulse to make sure the tourniquet isn't too tight. I feel a pulse, so it means it's not too tight. I'm going to take my iodine and in circular motions, start from the inside and go outside of the insertion site to clean it. 30 seconds. And I'm going to dispose of my iodine in the sharps container. I'm going to take my 20 gauge needle. I'm going to use my thumb to pull the skin taut, holding the vein down for stability, 1 to 2 inches under the insertion site. I'm going to insert my needle. I see flashbacks, so I'm going to go ahead 1/4 of an inch, and I'm going to push the pink hub off the needle. I'm going to retract the needle and dispose in my sharps container. I'm going to keep a hold of that catheter. I'm going to remove the tourniquet first. And now I'm going to connect the extension set. Making sure that the ends don't touch anything. I'm going to aspirate to see if there's blood. I'm aspirating, I see blood. So now I can flush the vein. Flushing, everything looks good. So now I'm going to clamp this extension set. Clamp, remove, normal saline, dispose. And cover the end. Now I'm going to take the sterile gauze, which I've initialed, dated, put the gauge, and the time is 13:20. I'm going to put the sterile gauze over the catheter. Making sure it's secure. I'm going to place this sticker onto the skin with the information. I'm going to take off the white cover. Making sure it's covering the catheter correctly. Dispose. And I'm gonna tape the tubing onto the skin. So it's nice and stable and it has the information on it. So I'm going to clean up. Make sure everything is put in the right place. Clean up. And I'm gonna remove my gloves. Dispose, perform hand hygiene with alcohol. Clean my hands, and I'm gonna walk away for now, and I'm gonna come back to remove. Can I have your full name and date of birth? Thank you. I'm gonna put on some alcohol, perform hand hygiene. I'm gonna put on some gloves. These are clean gloves. I'm gonna remove the sterile gauze and the tape. Dispose. Into the trash. Dispose. I'm gonna take a sterile gauze, hold it over the catheter, and I'm gonna pull the catheter out, slow and steady, parallel to the skin. Catheter is intact, tip is intact, and I'm going to dispose of this in the sharps container. Got a note that the catheter is intact. I'm gonna hold down for at least 30 seconds until the bleeding stops. I'm gonna dispose of this sharps container. I'm gonna get a new sterile gauze, fold it. I'm gonna place it above the insertion site. I'm gonna take some tape and tape it down. And that is the removal. I'm gonna remove my gloves, dispose. I'm gonna perform hand hygiene again, making sure my hands are clean. And that is the end of the removal. Thank you.